appreciate that under the leadership of current CM, Punjab has merged two departments, family planning, population department and the primary health department. And Secretary is sitting over here, and I must focus on single point. Today, when we look at the figures, the lady health worker program all over the Pakistan, it would be better, somewhat better, some fractions of the points would be better in Punjab. The Punjab lady health worker program, the time given to the family planning services is only, I think, 5.7%, 5.8%, which is very much below. As population minister, as public representative, as a medical doctor, I would say that we engage this issue with NFC and other larger issues. But will we see about what is happening with what we are doing with the low-hanging fruits like unmet need, like empowering the women to take decisions of family planning. I would say we are far behind. We should address these. These should be our priority at first. First, how we are going to distribute to address the unmet need at the village level, at the very basic level. Secondly, we must keep in mind that even with this whole efforts of lady health worker program, we are only addressing 60% of the population of Punjab. 40% urban population is still being neglected because of the absence of lady health worker program in the towns, in the cities, in the urban areas. Then how we are going to provide these contraceptive services or family planning services to those 40% living in the urban area. This is one debate we should focus on. And right now, this debate which Dawn has started right now, I think this would go forward and this would be discussed here. And it is also under discussion that how we are going to create something that the services of the population welfare department should come under the purview of the federal government. We are not talking about the services. Services will again be delivered by the provincial government. We are just talking about that how we are going to plan it and how we are going to execute the working hands would be of the provincial government. The federal government is not planning to take all this population welfare department into the federal government purview, and like our very esteemed guest just said, that this is a ping pong between the federal government and the provincial government. We don't want it to go further like this. The health departments, we want every province to follow Punjab's footstep, and I must appreciate Dr. Azra also as population and health, the common leadership. Under the common leadership, Sindh is also doing a lot better, but we should have performed. I would say the challenge is much higher than the normal or the good. We have to be par excellence in order to address this challenge in Pakistan. So when I talk about all the issues created because of the non-availability of the contraceptives, because of not having a universal coverage of family planning services, I would say the provincial government should sit together to look at the urban services, urban areas also, and look at the lady health worker program. Punjab has also, I came to notice that Punjab is also introducing community health workers, or likewise some replacement of this. So I would also request all the provinces, first of all, please go and map your services all across your province. Second step would be after that how you are going to bring the money, how are you going to bring this universal coverage into your program. This is the second phase. So thank you very much once again. I would commend the efforts and this Dawn Media for holding this very important dialogue. And I think this dialogue, this start of this dialogue, would also help us at the federal government and the provincial government to devise a plan, devise something new. We have to think something out of the box. Thank you very much.
Thank you, Dr. Bharat. Please, now I would request you to direct your attention to the screen for our esteemed speaker, Dr. Azra Fazal Pechuho, Minister for Health and Population Welfare, Sindh. She will be joining us online. She's live right now. Oh, can I please invite you to speak now? Thank you.
You want me to speak? Sorry, can you hear me? Am I
Yes, we
audible?
can. We can hear
Okay.
you.
First of all, let me tell you that the impetus that devolution has given to family planning in the provinces is commendable. I do not agree with Dr. Bharat's uh, premise that the devolution and taking family planning down to the provincial level has adversely affected family planning. My contention is that because implementation is with the provinces, the larger population also lies with the provinces. It was but sensible to devolve family planning and population welfare department down to the provinces. Having said that, I agree with him that a federal government has to do a lot. The federal government had committed 10 billion rupees in its when the federal court had decided that population was a critical issue, and they directed the federal government to give 10 billion to the provinces for family planning and population welfare services. But unfortunately, that money didn't come through from the federal government. So I have to take the federal government to task as well. So the balance between the federal and the provincial governments is of great issue. But I would like to say that there are certain asks from the federal government, which the provincial governments are saying. And that one of the asks is, we have, there was a stock, there was a question on commodity availability and let me tell you that Sindh is the only province who has a buffer stock and has ample stocks of all commodities, be it the long-acting contraceptives like LARCs, like Gidel and Implanon, or IUCDs, and the other shorter-acting condoms and pills. So we are in ample supply. In fact, we have more than an ample supply. We have almost a year's supply of commodities. So we are not in shortage of commodities because we spend about 990 million rupees just on the procurement of commodities, and we do it beforehand so that there are no stockouts. Unfortunately, what has happened is because of our relationships with India, the stocks that come from India, which is specifically the long-acting contraceptives, they're interrupted. And so I would suggest that the federal government should take on this opportunity to see that they give the directions so that the commodities are locally manufactured. Only IUCDs are being manufactured, unfortunately. That also is just a reassembling of the IUCD, and that also the IUCD that is reassembled is more expensive than the one that we can procure from abroad. We procure our IUCD from Brazil, which comes at a cheaper rate. So unfortunately, that increase at the higher rate does not allow us to procure local manufactured IUCDs. So in fact, all the commodities should be manufactured in Pakistan so that we save on dollars and also we save on costs. And we are assured no stockouts. Having said that, let me tell you also Dr. Bharat mentioned the Lady Health Workers Program. Sindh has been far advanced in the Lady Health Workers Program. In that we have now our cabinet has passed a summary regarding the Section 42 company that is going to hire the community health workers on contractual basis, which will allow us to fill in all the gaps of the Lady Health Workers Program, allowing us to look at the underserviced area. And obviously, we have rejuvenated the Lady Health Workers Program, redirecting them towards the family planning. Though obviously they have a lot to do they have a lot on their plate. They have health services to be that they deliver at the doorstep for women and children, and also because they are part of the polio teams and etc. So it also becomes very cumbersome for them, and we need to increase this workforce. Unfortunately, because they were regular employees, our financials didn't allow us to increase the workforce, and I think that Punjab also faced the same situation. And so we have now decided to go through a Section 42 company, have a third party hiring of community health workers, which have the same, which will perform on the same basis as a lady health workers, so having the same curriculum, etc. So the progress that we have made in Sindh. Let me go back to that, because obviously, having said that, devolution and taking the population welfare department down to the provinces has not worked. Let me tell you what, the first thing that we have done is we have centered family planning on a rights agenda. It's a human rights agenda, and we have done a legislation on this. It's the Reproductive Health Rights Bill, which assures that the woman has the right to contraceptives, and she has a right to deciding on how many children she is supposed to have. So it's a planned parenthood with consensual decision between both spouses, with marriage counseling involved in it also, so that we are very much ahead in this point. Obviously, everyone spoke about it being a rights issue. I agree totally. It's a rights issue. We have also done digitalization of our clients. And our service points have now digitalized services. We have also, I spoke about contraceptive stocks, which are being, we are not